Hi, everyone, and welcome. I'm Dr. Eric Bunge, Doctor of Chiropractic. See very serious cases most days of the week, and I'm an advocate of red light therapy. For 10 years now, I focused on class 4 laser, and 5, 6 years ago, I got one of the first, this is number 20 of the Theralite beds. I got one of the first Red Reactive panels, and now I have some custom-made panels, as well as we have little spot treaters, all sorts of other red light therapy, and every day that's what I do for my patients, my family, and my friends. Help them with medical grade sunlight and how it benefits today, tonight, and tomorrow, our cell metabolism, cell regeneration, and providing a rejuvenation and restoration of a good, healthy lifestyle. I took a pretty good fall. That's why I'm dressed like I am. I'm going to be using this as soon as the video is over. I'm going to treat my back. I took a slip at the end of the evening one night last week, and not only did I fall on my back, but my head hit the back of the shower, so I actually have whiplash. That evening went right, used my panel right away. I haven't had to take any medications. I certainly haven't gone to see anybody as far as needing something more serious in my case, because that's what I do every day. But at the same time, I'm telling you, these worked incredible. And a week later, I feel pretty good. I mean, my back doesn't limit me. By the end of the evening, I'm pretty sore, and that's why here tonight I'm going to be doing this in a few minutes. I'm going to show you a little difference between these two panels. People always ask, well, is this panel as good as the Red Reactive? No. Red Reactive was built by the family that makes Aspen Laser, and they also make the Theralite 360. And if you research the Superhuman protocol, that's the bed you use. That's the best bed in the world. And they made the best panel in the world. And there's a reason it's the best, is because it's designed for people who use class 4 laser with the higher wavelengths, the near wavelengths, okay? So like when we turn this guy on, see all that red? Now red's really great, but it only penetrates a short distance. You know, they have some belly busters for weight loss, and the reason it helps with weight loss is because it makes fat cells healthier and they release their triglycerides. So you actually burn some calories with a session of this. How much do you? 10 minutes. 10 minutes. Now you can see how bright it is there. So I generally have some sort of eye protection. Some folks think it's okay to stare at a bright light, but my common sense and all my clients, and I've been doing it for 5 years with the bed and all, we went a little bit, and you can still see that's pretty bright. So I've become very fond of these little guys right here. This is what I'll use, okay? And or you can just use a simple eye shield, something like that, a sleeping shield. But you can see it's pretty bright. Here in the control panel in the settings, we're going to see, we're going to hit the mode, and we're going to turn off that red for a minute. Okay, and so the reason I did that is because it was too bright. But I want to make a point here too. Those near wavelengths are very powerful, and I do like to have a little shielding of my eyes, at least of something, you know. You can, just a simple pair of good red light glasses are wonderful, you know. That way it doesn't come through here so much. And little red light's not bad for the eyes, but staring at any bright light's not necessarily a good thing. Red Reactive, when you turn it on, we don't have that setting, okay? And the reason is because they're designed in a way that it focuses on the near wavelengths rather than the red. And as I said, for folks who use class 4 laser every day, we know what those near wavelengths can do. They can penetrate the deepest. Very serious conditions are being helped with all sorts of, there's class 3 lasers are wonderful too. They just don't provide enough photons of light to get the whole body at once. I mean, it takes forever. Whereas we can do something like this, or something like the Theralite bed delivers a whole body approach in 10 minutes. So as I said about the light brightness, let's talk about how far. Generally, little hang 5 distance right there. Okay. In the front, you know, here we are. We can do it like this, and oh, you're pretty far from the face. No, that's fine. You know, these things are collimated, so they're aiming straight ahead, and you get a pretty good dose on your face here. It's not as thick, like say the muscles in place, so you don't need to put as much in the face, and you know, you don't want to necessarily heat the whole face up. You know, once you feel something's pretty warm, 3 to 5 minutes, if you know, rotate and do the other side. That's why I use a stool when I do these things. I'll be sitting here, and you know, in a couple minutes, as I said, I think I said I took a fall and have whiplash, and back's pretty irritated, and I'll just sit here and I'll spend a good 5 minutes, and then I'll come over here for a couple minutes, and then I'll come over here for a couple minutes, and then once that 10 minutes is over, I'll put my glasses on and I'll do the front. On Red Reactive, we can adjust the pulses, okay? So for instance, if we get down in here, see how it's doing that, okay? And then we get to a certain number of pulses, and it looks like it's on all the time, and we can even go continuous, which is full power. So it's like a sprinkler. You know, we got tick, 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 tick. That's how much is coming out. And remember, we need to have an adequate amount of red light therapy reaching the targets, the mitochondria, of all the different kinds of cell types to be a benefit. But it also reduces the amount of heat. So if we need to, someone sensitive, we can adjust the pulse, and therefore they'll get a great dose, but it won't get as warm. On these guys right here, we have the settings that, let's turn this guy off. So we talked about the mode, okay? And the mode is gonna turn on the red or near, and I always use both or just the near. But down here we have the brightness, and what is the brightness going to do is it's going to adjust the power. So is it 100%, 50%, 25%? But the other one is called the pulse, okay? And so again, the pulse width, we want it set at null. That means it's unthrottled. If there is a reason you do want to, it's getting too warm, or someone is just getting started and they're very sensitive, you can take that pulse width down to 100. It's a good beginning level. If you're savvy, a lot of neurologists, chiropractic neurologists, or they want a pulse width of 10 or 40 hertz here on the back to do. 10 is where our brain likes to sleep at 10 hertz. And when we're moving around, 40 hertz, I guess the brain functions at 40 hertz. But it's not too important for the work I do, which is just basically people are beat up. They want to feel better. They want to heal twice as fast. And they want a lasting benefit. I do a lot with neuropathy, pain, strains, things, people getting hurt in fitness. But it also is great for weight loss, helping skin. It builds collagen, so it prevents wrinkles. Look, I don't have any gray hair at all. I'm 60 years old. It's pretty impressive what it does. And bless the Theralite bed for 6 years. It's really kept me out of trouble. If you have any questions, you go in PubMed on your Google machine and put in photobiomodulation and something, okay? So photobiomodulation and weight loss, or photobiomodulation and arthritis pain, or photobiomodulation and, well, in this case, I looked up multiple sclerosis, and I wasn't too happy with the results because, honestly, they didn't have the right equipment. They were trying something, they got some things, they got some good, they saw some benefit, they said we definitely have to study it more, but you need a lot. You need to do the whole body. You need to do the central nervous system from head to toe, not just a little spot treating for a couple minutes with a little 100 milliwatts for a couple of weeks. It's just it's the risk of getting too much. I don't know if I've ever seen too much on anyone. So I went and I put in the same photobiomodulation multiple sclerosis, and I looked for videos, and sure enough, there's a great lady talking about the results that they had. So if you see one person that didn't get some results, look at the equipment. You know, once you get savvy, you realize, wow, they really didn't have much they're working with there, and maybe that's why they didn't get good results. Whereas, you know, someone that has the adequate equipment sees people being able to walk better, walk faster or longer, excuse me. And so you just look, and pretty much that's why red light therapy is becoming so popular. It's starting with skincare and hair restoration right now, and weight loss and arthritis pain, little spot treaters. You know, if you have some arthritis, you know, it really does help. Prehab, if you're going to have a surgery and you want something to heal better after, get it healing before. And that's what red light therapy, it's medical grade sunlight today, tonight, and tomorrow. So today, this red light therapy, wherever we can get photons with the right wavelengths and the right doses to mitochondria, it's going to kickstart, it's going to clean it out. Imagine an old carburetor and put some carburetor and cleaner and the engine starts humming better. That's how it works. And it releases nitric oxide, which immediately gets oxygen into the cells. As soon as you got energy and oxygen now, You have the cell membrane starting to allow glucose in. That's why it helps so well with diabetic wound injuries. It allows the waste to get out. And it doesn't just help any cell or whatever, it helps all the cells. So when I aim it here in my central nervous system, not only am I helping the nerves at their cell bodies and their axons and their dendrites, all the glial cells, all the epithelial cells getting circulation too, all the stem cells, the immune cells, the chondro, the bone cells, the fibroblasts that build collagen. That's why it helps with skincare, because all the different cell types are now able to work together and immediately that day provide relief from the daily oxidative stress. Important amounts of energy coming in, oxygen and nutrients and getting rid of waste. And so tonight, you're going to see a better cell regeneration. Tomorrow, you're going to see better cell metabolism, better what we call function. Cell respiration is going to improve. And that's going to keep building on itself. And that's why I say do it every day for 90 days, because 80% of our body is going to regenerate in 90 days. And you can benefit them immensely with adding red light therapy. Now, in addition, daily supplements, basic, good, solid multivitamin, omegas. You can add some B complex. There's probiotics. More importantly, digestive enzymes with every meal. And speaking of every meal, lots of plant-based nutrients. Those phytonutrients are the chromophores that get excited by sunlight. This is medical grade sunlight. And it's also less oxidative. Pro-inflammatory foods, cooked fats, especially anything over 215 degrees or whatever, it's just these foods are very pro-inflammatory. So clean up your diet, add some basic supplements, make sure you get red light therapy added, and you can actually go out in the sunlight for your 30 minutes. Speaking of sunlight, it doesn't have UV, so it's not about vitamin D, and all of us are taking vitamin D anyhow, but it doesn't have all those blue wavelengths, which are higher ionizing energy. It doesn't have the infrared, the thermal. It doesn't cook your skin. You ever seen how skin gets really, old very quickly when you put a lot of that thermal energy into it? You're just not going to see that. Instead, you're going to see this incredible rejuvenation and reviving of cell metabolism. So that's how I'm going to do it. And thank you for watching. I'm going to go here and put it on my back from head to toe for the next 10 minutes. Then I'm going to turn around and do the front. And thank you. And we'll see you on some more videos on how Doc B uses red light therapy today, tonight, and tomorrow to improve our life, to protect the injuries that we have, to respect our aging systems and restore mitochondrial function and help us enjoy living better. Thank you.